And we're back on this Saturday morning, Sports Medicine Weekly. Steve Kashul, Dr. Brian Cole. Time now for our Ask the Doctor segment. It gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues. You can submit a question. Just go to our website, sportsmedicineweekly.com. On the homepage, you're going to find a link underneath the photo of Dr. Cole and yours truly. And click on that link and you can submit your question. Again, our website is sportsmedicineweekly.com. Got a great question today, Dr. Cole, from one of our listeners. Dr. Cole, do you recommend blood flow restriction therapy when recovering from an injury? If so, for what kinds of injuries?
Steve, we do recommend it, and we use it frequently in our physical therapy centers. And blood flow restriction is interesting because, first of all, what it is the ability to constrict the venous blood flow. It's like basically putting a tourniquet on an individual. And we, by doing that, it changes some of the biochemistry and the proteins in the region and actually systemically in the body to create an environment where you can actually improve the ability for traditional exercises to be sort of augmented, or the results to be amplified. So we use it in a setting where we're trying to trick the body to sort of force a more expedited or more rapid recovery of muscle function in a setting where we often see atrophy. So we use it frequently after ACL reconstruction. What's interesting is we've even found that you can help patients who have had rotator cuff repair in the upper extremity, but you're obviously not going to constrict blood flow, upstream like the neck. That's not an option. But we've also found if you do a blood flow restriction in the arm, you can actually have a net effect on what we do for the rotator cuff. So that's been something that's been particularly beneficial. So almost all of our physical therapy centers now are doing blood flow restriction on a pretty regular basis.
Good. Got one more for you before we say goodbye on this Saturday. Dr. Cole, I get knee pain with physical activity. My doctor recommended gel injections. I have already gotten a cortisone injection with temporary relief. What is the difference between the gel and the cortisone?
So the gel injections are something called hyaluronic acid, and that's an injection whereby you can do a single injection or 3 injections, and people think of them as a lubricant, but it's not really a lubricant. And it essentially helps to reset the chemistry in the joint. It can provide some lubrication, but it probably works more based upon the chemistry of what we're injecting. And in effect, what it does is it reduces pain and inflammation and swelling that's often associated with osteoarthritis. It's most commonly used in the knee, but we use it in other joints. Rarely are there side effects, and can be very effective when someone has arthritis, but it's much less in terms of reducing pain, improving function, but really much less effective in people who are sort of bone-on-bone arthritis. The population doesn't do nearly as well.
Okay, good stuff. Dr. Cole, we're out of time. Have a great rest of your 4th of July weekend. Stay safe and stay healthy.
Thank you, Steve. You as well.
Many thanks to our producer, Shane Reardon. Also to David Cole for managing our website and our business operations, and Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul. We say so long, and thank you for listening to Sports Medicine Weekly. We'll be back next week with a brand new edition of our program. Have a safe rest of your holiday weekend, everyone, and please stay healthy.